You wake up every single morning, and before you even get out of bed, before coffee, before anything, you're already doing it. That sound, that low, grinding, embarrassing sound in the back of your throat that you can't stop. You clear it, it comes back. You clear it again, it comes back again. You've been doing this for months, maybe years, and every doctor you've seen has told you the same thing. Allergies, acid reflux, drink more water. Here's an antihistamine. So, you tried the antihistamine. Didn't work. You tried the nasal spray. Didn't work. You cut out dairy. Still there. Every single morning, that sound, that feeling, that thick, stubborn something sitting at the back of your throat like it owns the place. Here is what nobody has told you yet. It is not allergies. It is not old age. And the real cause, in most people over 60, is something completely different from what you've been told to treat. In fact, some of the things you've been told to do are making it worse. I'm going to prove that to you in the next few minutes. My name is Dr. Adrian Solberg. I focus on preventive health and senior wellness, and I've spent 2 decades making sure adults over 55 get the information their 15-minute appointments never deliver. Today I'm walking you through 7 specific science-backed reasons why you have that constant mucus in your throat, and exactly what to do about each one. Number 4 is going to make you rethink something sitting in your medicine cabinet right now. And number 6 is the one that turns a manageable problem into permanent damage, quietly, without a single warning sign. Stay with me. This one matters. Before we go any further, drop a comment right now and tell me, is your throat clearing worst first thing in the morning, or does it follow you all day long? Just type morning or all day. I read every single comment, and your answer shapes everything I'm about to explain. Here is the one thing you need to understand before we get into the list. I call it the drainage default. And once you understand it, everything else clicks into place. Your body makes 1 to 2 liters of mucus every single day. You never notice most of it because it drains quietly down the back of your throat, traps dust and bacteria, and gets swallowed. Silent, automatic, done. But after 63 things happen at the same time, the mucus thickens. The tiny hair-like structures in your airway, called cilia. Think of them as thousands of microscopic brooms working around the clock. Those slow down. And the drainage channel that used to run like a clean open garden hose starts to narrow and clog. Same amount of mucus, slower system, nowhere to go. So it pools, it sits, it catches at the back of your throat. And your brain fires one message over and over, clear it. Here is the critical part. Your body is not producing extra mucus because something is wrong. Your body's ability to clear what it always made has been compromised. That is a completely different problem, and it demands a completely different solution. Keep that in mind as we go through every single one of these. Number 1, silent acid reflux, and I need you to hear this clearly. It does not feel like heartburn. Most people think reflux means burning in the chest, a heavy feeling after a big meal. But there is a second form of reflux that produces 0 chest symptoms. None. It's called laryngopharyngeal reflux, LPRA. And instead of burning your chest, it creeps all the way up into your throat and voice box and deposits tiny amounts of stomach acid there. Your throat has almost no protection against acid, so even a microscopic amount, completely unfelt, triggers immediate irritation. And your body's response to irritation in the throat is instant. Make more mucus to coat and protect that tissue. You feel it, you clear it, 30 seconds later, it's back. Because the acid never stopped coming. A 2019 study in otolaryngology, head and neck surgery, tracked patients with chronic throat clearing and found that LPR was the underlying cause in 55% of them, and that the overwhelming majority had 0 heartburn symptoms. 0. Here is what that looks like in real life. The acid creeps up at night while you sleep. Your throat gets irritated, your body floods it with protective mucus. You wake up clearing your throat before your alarm goes off. You spend your morning thinking it's allergies, and every antihistamine you take does absolutely nothing, because histamine was never the problem. What to do starting tonight? Elevate the head of your bed 4 to 6 inches with a foam wedge pillow, not an extra pillow, an actual wedge. Stop eating 3 hours before you lie down. Cut carbonated drinks, mint, chocolate, and coffee first. They physically relax the valve that keeps acid from traveling north. And when you see your doctor, ask specifically about LPR, not GERD, not heartburn, LPR. Those are treated differently. That word matters. Number 2, your blood pressure medication. This one. This is the one that makes people's jaws drop. There is a class of blood pressure medications, some of the most prescribed pills in the world for adults over 60, called ACE inhibitors. You may be taking one right now. Lisinopril, enalapril, ramipril, benazepril, any pill ending in pril. These drugs are excellent for the heart, but they have a side effect that most prescribing doctors never mention: a chronic, relentless throat clearing and dry cough that can start 1 week after you begin the medication, or 1 full year later. Whenever it starts, it doesn't stop. Not until the drug changes. Here's why. ACE inhibitors block a specific enzyme. That blockage causes a substance called bradykinin to build up in your airways. Bradykinin irritates the airway lining. Mucus follows. The urge to clear follows. Every hour, every day, for as long as you take that pill. A 2021 review in the British Journal of Clinical Pharmacology found this happens in up to 20% of all patients on ACE inhibitors. And in women over 60, it climbs to nearly 30%, nearly 1 in 3. Think of it like a car alarm that won't shut off. The car is fine, the engine is fine, but the signal is wrong and it just keeps firing. Here's the tragedy. A person starts lisinopril in January. By July, they're clearing their throat constantly. They go to an allergist, nothing found. They try 3 different antihistamines, nothing. They see an ENT, nothing. A year and a half goes by. Nobody ever asked what medication they started 6 months before the symptoms appeared. Pull out your medication list tonight. Look for any drug ending in pril. If you find one, bring this exact sentence to your doctor. I've read that ACE inhibitors cause chronic throat clearing in up to 30% of women over 60. Could switching to an ARB be appropriate for me? ARBs do the same blood pressure job without the bradykinin buildup. Type the number 2 in the comments right now if you're on a blood pressure medication ending in pril. I want to see how many of you this is hitting. Number 3, the dehydration your body stopped warning you about. Here is something most people over 60 have never been told. Your thirst mechanism weakens with age, significantly. The biological signal that tells your brain you need water. That signal becomes unreliable after 60. Your kidneys also become less efficient at conserving fluid, so you can be genuinely, meaningfully dehydrated and feel completely fine. No thirst, no warning, nothing. And the connection to your throat is direct. Mucus is 95% water. When your hydration drops, your mucus thickens. It stops flowing. Instead of moving smoothly through your system the way it should, it gets sticky and heavy, like syrup instead of water, and it clings to the back of your throat. Every attempt to clear it just pushes it around. A 2020 study in the Journal of the American Geriatric Society found that more than 40% of adults over 65 living independently had measurable signs of chronic mild dehydration. And that group reported significantly higher rates of persistent mucus and throat clearing. You are not producing too much mucus. You are producing mucus your body can no longer move because the water content is too low. What to do? Stop drinking based on thirst. Your thirst cannot be trusted anymore. Set a timer, use a marked bottle, 6 to 8 cups of plain water daily. Warm water and herbal tea count. Coffee and alcohol, do not. And tonight, before anything else, put a glass of water on your nightstand and drink it the moment you wake up. Your throat membranes lose significant moisture overnight. That 1 glass before your feet hit the floor changes your entire morning. Number 4, a food connection your doctor has probably never mentioned. The old belief, the one you've probably heard, is that dairy causes the body to make more mucus. Research has since shown that is not accurate for most people. What dairy can do is temporarily thicken mucus that is already present. That's different. And for people with a sensitivity to casein, the protein in dairy, there can be a real inflammatory response. But here is what nobody is talking about, and this is the part that should have your full attention. After 60, a significant number of adults develop histamine intolerance. Histamine is a natural compound found in aged foods, wine, aged cheese, fermented foods, cured meats, certain fish, even spinach. Normally, your body produces an enzyme that breaks histamine down efficiently, but that enzyme weakens with age, so histamine accumulates. And one of its primary effects is triggering mucus production in the upper airways. A 2022 study in the journal Nutrients found that adults over 60 had a 48% higher rate of histamine intolerance than adults under 40, and that chronic throat clearing was one of the top 3 symptoms reported. Think of it as a bucket. Everyone has a histamine bucket. When it overflows, too many high histamine foods in a single day, symptoms pour out. At 30, your bucket was large and your enzyme was fast. At 65, the bucket is smaller and the enzyme is slower. The same glass of wine that never bothered you a decade ago now sends the bucket over the edge. What to do? Run a 2-week experiment. Remove the highest histamine foods from your diet. Aged cheese, wine, fermented foods, cured meats. Note what changes. This is not a permanent restriction. This is a diagnostic tool. If your throat clearing drops by half in 2 weeks, you have a meaningful clue and a conversation to have with your doctor. Hit the like button right now if you've never heard histamine connected to chronic throat mucus before. Because this is real, it's researched, and almost nobody talks about it. Number 5. Your nose is draining, but in the wrong direction. The back of your nasal passages connects directly to the throat through a channel called the nasopharynx. When that nasal lining gets inflamed, from allergens, dry air, dust, pollution, or simply from the membrane thinning that happens naturally after 60I excess mucus forms. And instead of draining out the front, it drains backward, down into your throat, all day, constantly. This is post-nasal drip, and the reason it gets worse after 60 is specific. Your nasal membranes thin with age. They dry out faster. Dry, thin membranes produce thicker mucus that moves slowly, backward, not forward. And if you add seasonal allergens or a dry indoor environment on top of that, the problem compounds fast. A 2018 study in allergy and clinical immunology practice found that in adults over 60, chronic post-nasal drip was caused by a combination of age-related structural changes and allergen sensitivity in over 60% of cases, and that using a saline nasal rinse twice daily reduced symptom severity by 43% in 4 weeks. Your nasal passage is like a drainage ditch. When it is moist and wide, water moves through cleanly. When it dries and narrows, water backs up and spills the wrong way. What to do? Get a saline nasal rinse kit, a squeeze bottle, or a neti pot from any pharmacy. Under $10. Use it morning and night with distilled water. Never tap water directly. Run a humidifier in your bedroom. If your symptoms follow the seasons, ask your doctor about a nasal steroid spray. It's safe for long-term use, and it addresses the inflammation directly at the source. Number 6. And I need you to pay close attention here, because this is the one that creates permanent damage without ever announcing itself. The act of clearing your throat is hurting your throat. Every time you clear your throat, you are forcing your vocal cords to slam together at significant speed and force. Once or twice, no problem. But 20, 30, 40 times a day, every day, for months or years, that is repeated blunt trauma to delicate tissue. The result is a condition called muscle tension dysphonia. The muscles surrounding your larynx, your voice box, become chronically overcontracted from constant misuse. And here is the part that makes this a true trap. That tension makes the sensation of mucus feel more intense. So you feel the urge to clear more, so you clear more, so the tension increases, so the sensation gets stronger. The clearing is feeding the very symptom it's trying to fix. A 2020 study in the Journal of Voice found that adults with chronic throat clearing showed vocal cord thickening and early nodule formation at rates 71% higher than those without the habit, and that the damage was tied directly to frequency of clearing, not to the underlying cause. What to do? Learn the silent swallow. Right now. The next time you feel the urge to clear your throat, take 1 sip of water and swallow with your chin slightly tucked downward. That motion moves mucus without impact on the cords. It feels wrong at first, Like it didn't do enough. Do it anyway, every time, for 2 weeks. The habit rewires. And ask your doctor for a referral to a speech-language pathologist who specializes in voice. 2 or 3 sessions can break this cycle faster than any prescription. Type the word voice in the comments if this is the first time you've heard this, because it should be talked about far more than it is. Number 7, what is happening to your throat while you sleep? If your throat clearing is worst in the morning, if you wake up with a dry mouth, if your partner has mentioned snoring, if you never feel truly rested no matter how many hours you sleep, then this one is for you. That exact pattern is one of the clearest signatures of obstructive sleep apnea. Here is the connection. When the airway partially closes during sleep, your body automatically shifts to mouth breathing. And mouth breathing bypasses your nasal passages entirely, which are your body's built-in humidifier and air filter. The air that reaches your throat overnight is dry, cold, and unfiltered. Your mucous membranes respond the only way they know how. They produce more mucus to compensate for the dryness. That mucus accumulates through the night. By morning, it has thickened and settled, and your first 20 minutes awake are spent trying to clear what your airway collected while you slept. A 2023 study in Sleep Medicine Reviews found that over 60% of adults over 65 with chronic morning throat clearing had undiagnosed or undertreated sleep apnea, and that treating it with CPAP therapy eliminated or dramatically reduced morning throat clearing in more than 75% of those patients. Think of it this way. Leave a sponge on a dry counter overnight. By morning, it is stiff, cracked, hard. Your throat tissue is doing exactly that, drying out, stiffening, generating thick secretions. Every single night, you sleep with your airway partially blocked. What to do? If your clearing is heaviest in the morning, if you have a dry mouth when you wake, if you snore, ask your doctor for a sleep study. Home sleep tests are now simple and widely available. And understand, this is not just about your throat. Untreated sleep apnea is a serious cardiovascular and neurological risk. Fixing it may solve the throat problem as a bonus from doing something far more important. Now here is what I want you to actually do, starting tonight. 6 steps. Concrete. Specific. Step 1, tonight, free. Elevate the head of your bed 4 to 6 inches with a foam wedge, not a pillow, a wedge. This reduces overnight reflux and post-nasal pooling from the first night. Step 2, tonight, free. Fill a glass of water and put it on your nightstand right now. Drink it before you stand up tomorrow morning. That one act rehydrates your throat membranes before the clearing cycle even begins. Step 3, this week, buy a saline nasal rinse kit from any pharmacy, under $15. Use it morning and night with distilled water. The evidence behind this is strong, the risk is 0, and the cost is nothing. Step 4, tonight. Pull out your medication list. Find anything ending in "pril." If it's there, write down this sentence and bring it to your next appointment. Could my ACE inhibitor be causing my throat clearing, and would switching to an ARB be appropriate for me? Step 5, right now. Practice the silent swallow instead of clearing. Sip of water. Chin slightly down. Swallow firmly. Do this every single time you feel the urge. Give it 2 weeks before you judge it. Step 6, this week. Keep 3 days of notes. What you eat. When the clearing is worst. Whether wine, cheese, coffee, or fermented foods show up before the worst episodes. Bring those notes to your doctor. You will have done diagnostic work your appointment never had time to do. And please, see your doctor promptly if you notice blood in your mucus, progressive difficulty swallowing solid food, a worsening lump sensation in your throat, unexplained voice changes lasting more than 3 weeks, or ear pain on one side alongside throat symptoms. These are uncommon, but they matter and they cannot wait. Here is the bottom line. The mucus in your throat is a message. It is coming from your medications, your reflux, your sleep, your hydration, or the food on your plate. And every single one of those sources can be identified and addressed. You do not have to live with this. You are not just aging. You are dealing with specific, identifiable, addressable physiology, see? And you deserve to know that. I have a video coming very soon on exactly how silent acid reflux connects to heart rhythm disruption and nighttime sleep. A connection most cardiologists never mention in the exam room, see? And that is not a conversation you want to miss. If this gave you something real today, subscribe and share this with one person over 60 who has been clearing their throat at every meal for years. You might change what happens to them. And leave me a comment before you go. Which one of these 7 hit closest to home for you? I read everyone, and your answer shapes exactly what comes next. I'm Dr. Adrian Solberg. I'll see you in the next.